few months. As the time period elapses, they do notice a little bit more and more constipation. But at that initial injection, they do realize a lot of relief and they are able to pass stool normally. Some side effects that you could potentially see with these injections include urinary incontinence, pelvic muscle paresis, perianal abscess formation, pruritus ani, and rectal prolapse. Now, the myectomy is the definitive treatment. And there's a lot of studies that show that a lot of the individuals who do get myectomy, majority of them do remain asymptomatic for the remainder of their lives, or they would have to just be taking a low to medium dose laxative. There are very, very few percentage of patients who find refractory symptoms after getting this procedure done. Some of the complications that you can get with it include fecal incontinence. You could get rectal bleeding as well, of course. You can get rectal urgency, prolapse, and studies have shown some issues with poor wound healing that are associated with this procedure. Some of the detrimental effects of this procedure have not become apparent suddenly. There are recent studies that are showing that several years after this procedure gets done, that there are some complications that are kind of coming up with it. But again, those are a lot of recent studies that are being done, and there's not a lot of information on that currently.
All right, so that's basically, the gist of this condition, internal anal sphincter achalasia. So just to sum up, it's an absence of the rectoanal inhibitory reflex, which causes the symptoms of chronic constipation and abdominal bloating. The biggest issue with this disease that we found is that the symptoms can be overlooked for a very long time. Pediatric constipation is a very common condition in that population, so a lot of times further workup isn't really done. So if a patient does have this condition of IASA, it's typically not diagnosed until later in their childhood, even into adolescence, as was seen in this patient. So it's really important to increase awareness of internal anal sphincter achalasia, so that hopefully we can start doing earlier diagnoses of this and improve the quality of life for these patients. And it's just some of our references, so that sums it up.
Perfect, thank you. We could leave it up to any questions for right now that are in the chat. Otherwise, I have just one or two questions, if that's okay.
Sure.
I'll just go ahead and start first. I know this. You mentioned that this disease is very rare. As far as we know, are there any groups of people that are at risk with this condition? Is it hereditary? I know with Hirschsprung disease, it's related to people with Down syndrome. Just wondering if we know any information on that front.
Based on our research, from what I can remember, I didn't see it having a higher occurrence in a particular demographic. But that's probably just due to the limited number of cases that have been reported. There have been just a handful of studies done on this condition. So I didn't see too many specific statistics about demographics on IASA, but that's just from what I remember.
Okay, no worries. Appreciate that. And one last question from me. Are there any, I should say, any risk for any diseases or cancer later in life that these patients are at risk that we know of?
I didn't catch that question.
Oh, sorry. I'm gonna go ahead and repeat it. Do we know if the patient who has this disease are increased risk for any other diseases or cancers later in life?
At the time, I don't really think so. Again, as Farah was saying, because there is such limited studies, there hasn't been any trends that people have noticed. As I mentioned in my slide, I was saying how there's been recent studies coming out about complications several years after treatment and things like that. Those have just been recent emergences, and that's kind of all the information that's out there at the moment.
Yeah, I think the typical follow-up for these patients mainly focused on like how well they're responding to their treatment, whether that be the Botox or the myectomy. So I didn't see any specific studies following up on, any other health conditions that may have arisen.
Okay, no worries. I'll just leave it up to the chat to see if there's any other like questions that may pop up in the next few 10, 15 seconds.
I have a question for Farah.
Sure.
What was the treatment for the patient you saw with it? Did they do the Botox or the myomectomy?
Yeah, so the patient that I saw came in every 6 months for Botox injections. And she reported that she had relief of symptoms for about 3.5 to 4 months, honestly. But she tried to stretch out her treatment so that she'd only have to come twice a year because it's basically a whole day gone. It's a day procedure. She has to come in early, she has to be put undergo the injections and then go in the recovery and all that. So she basically just endured 2 months of constipation symptoms, bloating, and discomfort and all that before her next set of injections.
Okay.
Mhm.
Is it the first case your surgeon had seen of it, or who would take care of doing the Botox for the management of her
Yes.
treatment?
So this was the particularly interesting case that I came across, and it's actually the one and only patient that Dr. Bozeman has seen with this condition. So
Okay.
very, very
So we'd probably
uncommon.
have to learn how to do that myomectomy if that was the way she'd want to go, right?
Right. He would be able to perform it. A pediatric surgeon would definitely be able to do that. I'm sure a general surgeon would as well. However, he was just more concerned about the potential complications. She is at a stage of her life where she's planning to go to college, this and that. She wasn't very comfortable with the possibility of having, fecal incontinence and things like that to worry about.
Right.
So,
So,
the treatment just kind of has to be based on patient preference and, surgeon preference and comfort level and all that.
yeah. Cool. Thanks.
Yeah.
We have a couple more seconds to see if there's any more questions.
All right.
Okay. So thank you, Roche. Thank you, Farah. Thank you, Matt, for giving us this presentation. It's definitely very informative. I personally never heard of anything like this, so it's awesome to see what you got or listen to what you guys have encountered in a clinic.
Yeah, wonderful. Thank you for allowing us to share our patient case.